Hello, everyone. This is Dr. Kasia Kines, CEO and founder of the Global EBV Institute. Today, we're talking about certain labs that you should consider testing or asking your doctor to test that may not be done and should be done and may not be done properly. And so it's good to be your own advocate and know what to ask for. And also, you can use direct to consumer labs. So you can have these tests done directly without your doctor. So life is easier. You may not even be aware of that. So let's talk about the labs. The number one lab that I want to discuss is iron panel. There's actually five markers in the iron panel that you should include or ask to be included, and a good panel should have all of them, but I'm going to focus on two: the iron itself and ferritin. So the iron itself is, in the blood. If that's what the doctor tests, it will be iron and ferritin, and that's it. So iron can be good depending on what you ate during the day. So it just reflects your diet and your ability to get the iron from the stomach into the intestines and into your system. So it doesn't really reflect your long-term status, I'm afraid. So it's not enough. Now, ferritin is a 3-month status. It's a storage of iron, can be very dangerous if it's elevated and if it's too much in supplementation. So you have to be very careful and not supplement indiscriminately alone without supervision. But ferritin is a much better status telling you what your iron is. Just low ferritin may indicate that you have iron anemia. Low ferritin can indicate that you don't produce enough stomach acid. You may have hypochlorhydria or even achlorhydria. You can have EBV, you can have pernicious anemia. We're going to talk about lab tests for that. You can have SIBO, leaky gut. All these can manifest as low ferritin. So depending on the lab, the range goes from maybe 11 to 300s. And honestly, for a woman to grow hair, you need at least 70. And so you can feel that you have normal iron because your ferritin was 50. Well, 50 is just not cutting it. You want to be closer to 100 and above. Now, what happens if you have high ferritin and high iron? You may have hemochromatosis, which is a dangerous genetic condition, especially if they go into like high numbers. It's inherited and you have to test for it. You can test for hemochromatosis with any doctor. It's just a very simple test. And then if you have it, you have to donate blood periodically just to keep the ferritin and iron more stable. And again, it's very dangerous because, like I said, iron is very dangerous in high levels. The body regulates and controls it very tightly. That's why it stores excess iron as ferritin, and you can die from overexposure of iron. What happens if you have low ferritin? That can be iron anemia, and then you want to supplement. You want to work with a practitioner to see, why am I not having enough storage of iron? Is it my stomach issue? Is it infections? Is it, what is it? So that's another conversation. What about high ferritin and low iron? See, that's confusing. There's something called anemia of inflammation, and high ferritin is dangerous, as I said. So you want to exclude that hemochromatosis if both iron and ferritin are high. But with low iron, anemia of inflammation is infections. It could be EBV. You just have to work on inflammation, bring it down. You definitely don't want to supplement with iron in that case. The second thing I want to talk about is pernicious anemia. It's a condition that it's an autoimmune condition. It's something that a lot of medical doctors miss because it's relatively rare, except in our community. So some of the worst cases of EBV that I've seen, as a clinician, we would pursue testing for pernicious anemia if I suspected it, and I have been able to help people, diagnose that with their doctors because of two simple antibodies in blood tests that the doctors can test, and you can test directly: parietal cell antibody and intrinsic factor antibody. So Pernicious anemia is when your body is attacking the stomach, the cells that are responsible to make stomach acid, to transport B12 from the stomach to the intestines for absorption. So when you have pernicious anemia, oftentimes you have achlorhydria or severe hypochlorhydria, which means you are not producing stomach acid, which is very dangerous. Let me repeat. People struggle with too much, acid, so to speak, which is not correct entirely, with, reflux, acid reflux. But the problem is low or lacking stomach acid is very dangerous. The achlorhydria, when you don't produce stomach acid, is life-threatening. And so what we see is people losing weight, being underweight, not being able to eat much, and having a host of critical conditions, and just not understanding what's happening, not being able to eat, having allergies. It's like a worst case of celiac. This is where we suspect pernicious anemia, and of course EBV will come on this ride together sometimes. And sometimes for women, pernicious anemia shows first as low ferritin, low iron, and that's what studies show. So anyway, cell antibody, intrinsic factor antibody, very simple to test and dangerous to have it. And if you're really, really sick, that's what you want to do. The next thing I want to discuss is homocysteine. Homocysteine is, again, a simple blood test. Any doctor should test it. I think it should be in physical, always as part of the blood work. Homocysteine is an independent risk factor for heart attacks and stroke. You can have perfect cholesterol and end up with, stroke because homocysteine is elevated. Homocysteine is kept in place with proper folate, proper B12, proper B6, methylated in supplements, good food sources, and you should keep it within 4 to 8, ideally about 6. So if it starts going higher than 8, you already have increased risk of cardiovascular disease. And what you need to know in our context is that homocysteine is very dangerous for the brain, for your arteries. Like I said, it can cause damage, just like arterial blocks, just like cholesterol, but it has a free pass into your brain. It's very important, and it can literally set your brain on fire. It could cause so much damage in your brain. So you want to make sure that you just test it periodically, see where it is. The range is too big and too lax. The range is all the way to 15. But if we looked at a study, people with 15 or above, all the study group that was tested later developed Alzheimer's. So it's extremely inflammatory. You want to keep it in mind. And so, yeah, so these are the tests. And of course, we talked about thyroid in a different training. You want to make sure that you test TPO antibodies and thyroglobulin antibodies to exclude Hashimoto's thyroiditis, which is autoimmune condition, and also reverse T3. These things are typically not tested by a doctor, and so you can have perfect TSH and already have autoimmunity and be miserable, and your labs are perfect. So these are the tests that I would recommend. Go ahead and get these tested if any of what I said resonates with your condition, and you can get proper help this way. I hope it's helpful. Thanks for watching.